Hello, and welcome to Kids Coping with COVID, the final session in our series, Your Mental Health. I'm Louise Campbell, Vice President of Lionsgate Hospital Foundation, the fundraising arm of the hospital and all publicly funded healthcare facilities and services across the North Shore. It is expected that the COVID-19 pandemic will have long-term impacts on our children and youth. How can we help them navigate the disruptions to their routines, and where can we find the resources and support to help them navigate and deal with the changes in their lives? The Foundation has developed this webinar series to share with the wider community the knowledge and expertise of our North Shore mental health professionals. I spoke with Julie Zimmerman, Manager, Mental Health and Substance Use, North Shore Foundry Youth Services, who shared her professional strategies and suggestions on supporting children and youth during this challenging time. Hi, Julie.
Hi.
Thanks so much for joining me here today. We're sitting at a safe distance, we've taken off our masks, and we're here at Foundry North Shore. Tell me about this great facility we're in here in Lower Lonsdale.
So I often refer to Foundry as a hub for youth services. So here at Foundry, we offer a lot of things on site. So we have our drop-in program, which provides a variety of kind of come when you need to in-time support. And that could be for something related to mental health. It could be something related to social support, wanting to get connected to something else in the community. It's also often people coming in wanting some medical support or support around sexual health. We also have a new support called YURT. YURT stands for Youth Urgent Response Team. So it's a phone number that people in the community can call, schools can call. The emergency department often calls us as well as almost a step down from emergency service. So when someone feels like, wow, I need something right now, I'm in crisis, or my youth is in crisis, they can call that number and they will get a call back within, usually within an hour or two, but we usually say like, give us a day. And oftentimes we're able to provide support or resources on the spot. We have some longer term supports here as well. So we have a counseling and case management program here for youth that have mental health and substance use co-occurring. So we have a counseling team, we have a case management team that's able to go out in the community and do outreach. We have an occupational therapist. We have groups that are both online right now, and as well we're trying to reestablish some groups person to person in the community at safe distance. A lot of those groups will be recreation based after spring break. We have people with lived and living experience with mental health and substance use. We call them peer support workers here. So we have peer support workers here on site to provide mentorship, to share their stories, to let youth know that what they're experiencing isn't just theirs alone, that other people have maybe experienced some of the things they've experienced. And we also have a parent support that is a parent who has lived experience having to somehow try to navigate the system for her kids. So we provide services via Zoom, we provide services via phone, and we provide services in person when people are coming to our door and want help.
With the onset of COVID, are there more youth, young adults, and families seeking help at Foundry?
Yes and no. It kind of depends. Our numbers month to month right now, so we're sitting in March, are not that much different than they were pre-COVID. And we're actually seeing that as a good sign, because for a while we weren't seeing anybody, because people were holed up and we were all supposed to be staying at home and not making calls and not coming in. And so we saw really low numbers probably until the summer. And I would say now we're back to kind of that average amount. But what I am seeing is that when people are coming in and asking for help, that there are many people now that I'll use a medical term called acuity. So acuity is high. So that would mean that they're coming in less well than they would have before. It's almost like they're waiting longer. So they're becoming less well by the time they come in. So some of the things that we've also noticed is an increase in youth in emergency for mental health and substance use, and also an increase in admissions to our pediatric unit for mental health and substance use. So that suggests to me that there are some people that are waiting until things are really bad, but people are feeling more on edge than they did when they would have come last year.
So you would recommend people coming before they get to that
Yes.
point of waiting too long?
Yes.
So and what have been the psychological impacts you've seen of the pandemic on youth?
So I think the biggest thing that we have seen for sure is increased anxiety.
Right.
Generally, and that's not just a youth phenomena, that's kind of a human phenomena right now, and youth aren't excluded from that. So we're seeing a lot of youth coming in with increased anxiety. I actually asked some of my community partners this as well, and some of the things that they had said is that what they're hearing is more youth and parent conflict. Not surprising, because we're in each other's spaces a lot more and we're all feeling a bit more stressed. Youth struggling with social isolation, feeling alone. Families that are struggling with finances. So the struggles that families face trickle down to their kids. So things like stress, food insecurity, maybe parents aren't working as much as they used to work. Adjusting to new norms at school has been something I've heard quite a bit. That for some youth where change is already hard, having to deal with a quarter system in high school and then having that change and having it change quite a few times. I know we even had that change yesterday in our house where it was like, am I supposed to be at school all day now? Can I sleep in? Am I supposed to be there? Right? That kind of stress and anxiety. Something that we have definitely seen here at Foundry, and I have read that nationally we're seeing this, is an increase in disordered eating. So that's a huge concern.
And why do you think that is? Is that because it's something that youth can control, and there's so much that we can't control right now?
That is my hypothesis.
Right.
I mean, I'm not a researcher,
Sure.
but when I think about it, and I think, so you're in your house, your world has gotten really, really small. There's all these things you can't control, but you can control this one thing. And then something that's not necessarily mental health specific, but something we see here is an increase in pregnancy and STI rates. So STI is sexually transmitted infection. And my guess around that is that it's not about an increase in sexual activity in our youth, but that it may be a decrease in access to contraception. So we are seeing that here, which we have not seen for a very long time. So public health nurses typically provide sexual health to youth, and they're all working to support us in our COVID response right now. But I think the other thing that I've also heard from my team and from community partners is to point out that there are some youth out there that are doing better now than they were doing before. So there are some kids that maybe previous to COVID were struggling with anxiety related to school or anxiety related to social situations, and the precursor to their anxiety has actually been taken away. And so they're actually functioning better. And so that's where something like a global pandemic doesn't affect us all the same way. We have some youth that are attending and connecting to services better than they ever have before because they don't have to leave their house. They don't have to get down here for an appointment.
So our two teens are home on Friday and Saturday nights on their screens, and I'm sure they're not the only ones out there. How does this new normal impact their social development?
Well, this is something that strikes close to home for me as well, because I also have teenagers and they're at home and they're on screens. And so I guess the first thing to look at is, I guess, that there is a small bright side in that when our kids are choosing to stay home, they are choosing to follow the rules that we've asked them to follow. And I think actually many youth are trying to find a way to socially connect using screens. So that's the other bright side, is that I think when we see, as adults, we see kids on screens and our assumption is that all of that time is useless, right? Or not helpful, but that there is some time that they're using on screens that they are using to try to connect. But I mean, there's also a huge smattering of TikTok videos and YouTube videos that me, like every parent, like it drives me up the wall.
Talk to me about some of the factors that are at play to determine how well or how challenged a family might feel during the pandemic.
I've seen it posted probably on my Facebook page. This idea of that we're all in the same storm, but we're not all in the same boat. So not all families are experiencing this the same way. And I know not all families are experiencing COVID the way my family is experiencing COVID. And so I think some of the things that may influence that are factors such as, is there one caregiver or more than one caregiver in a house? I think where and how we live impacts how COVID has affected our family. So families that have homes where there might be various places for people to be alone are different than homes in which there might only be one living space that people share. I think there's also the social factors of families that might have connections nearby that they're still able to somehow connect in with or get support from. Whether that's, I know that people have their own bubbles, but for people that have family from far away, you might not get somebody that brings soup to your door or leave something on your doorstep, right? And there's also just the pre-existing factors, I think, too, of mental health and other pre-existing factors that might make a stressful situation more stressful during COVID, right? So I'm thinking about even within my own family, each of my kids comes with a beautiful bundle of strengths and challenges, right? And I would say that their challenges have been more challenging during COVID. And so for those families that have those challenges before COVID, those challenges might have gotten harder.
So if we feel like we're struggling, talk to me about where exactly we can get help on the North Shore.
I think we are very, very lucky on the North Shore to have such a variety of community resources here. Family Services on the North Shore produced a fabulous podcast for parents. Hollyburn Family Services provides a lot of support in the community, especially around youth with special needs, as well as housing for youth, especially youth aging out of MCFD care. So they do a lot of work in our community supporting families in need. Another really fabulous resource that I think many of us forget about is our community services. So places like Parkgate, North Shore Neighborhood House, John Braithwaite, Capilano Services, West Van Community Center, all of those centers have youth outreach workers that their role is to connect with kids and to connect them to different things that are happening in the community. And you know, for some kids, that's all they need. And I think lastly, I don't want to forget how much effort the school districts have been putting in to support youth and family right now. I know that West Van School District has done a few webinars for parents. And I also know that the North Van School District has a website with a link, and that link provides a ton of different resources for families around mental health and wellness.
We're feeling challenged as parents. And I'm wondering if you have any tips that you can share for parents dealing with their kids during the pandemic.
Well, I guess my first is just to recognize that I think we're all feeling the same way. I think it's easy to feel like the parent that isn't doing enough. I think it's easy to be the parent that thinks you don't have it all together. And I think the reality right now is COVID is a bit of the big equalizer. None of us know how to do this. But saying that, here's some ideas, because it's always nice to have some ideas. To really encourage parents to think about their own self-care. And when I'm talking about self-care, I'm not saying make an appointment for a manicure and get a new outfit. I'm saying things like make sure you get your sleep. Make sure that you're eating okay. It's things like let yourself buy your favorite fruit. Give yourself some slack if the laundry doesn't get done. Don't worry if not every supper has all the vegetables that you think it needs to have. And so I think self-care sometimes is cutting ourselves a little bit of slack and taking care of the bare essentials. So get your sleep, drink your water, get some fresh air, and buy yourself your favorite fruit or your chocolate bar if that's your choice. Whatever routines work in your household, hold them, protect them. One of the routines that has been a lifesaver for our family during COVID is supper. We eat supper together, and we do not do supper perfectly. We have many arguments over the supper table, but it's our chance to connect and laugh, actually. And it's been my silver lining. As well as cutting ourselves some slack, we need to cut our kids some slack. It's hard for everybody to be human right now. And so, when they're on screen time longer than we would like them to be on, sometimes we have to decide if we're going to let that go. When it comes to difficulty with mental health too, there's no perfect solution. And so what I often try to think of is, instead of moving towards perfect, how can I move towards being more functional? What are ways that are going to help us function right now? Because I think when we find ways to help us function better, whether that's I'm gonna focus on my sleep, or I'm gonna try to get outside and walk around the block, that gives us that next step towards more function, right? But I think that little bit of grace that we can give each other is a little bit, it's like WD-40. Sometimes it can just help things get unstuck. There is a practice in mental health. It's got a long fancy word and it's got a nice short acronym called DBT. I'm not going to go into all of that, but there's some elements of that I've incorporated into my life, and I know that we work really hard to teach our kids here. So one is this idea of mindfulness. A lot of people know about mindfulness. I'm not very good at mindfulness. Mindfulness is this idea of being able to sit and notice. And so for me, I've actually substituted the word mindfulness for myself with notice without judging. So, because we can notice a lot of things and judge them. I notice a lot of things at home and I judge them. But I can also notice things and not judge them and be mindful and be in that moment. And I think that can be really grounding for us. We can notice the things that our kids do right, even in the midst of the things they do wrong. The other piece of DBT is called, the fancy word is emotional regulation. The simpler version is feel your feelings. Feel your feelings, and then let them go. Especially in March 2021, there are a lot of feelings. There are a lot of big feelings. Adults are having big feelings. Youth are having big feelings. And that's okay. The hard part is to let them go, kind of like waves, right? Another one is what we call distress tolerance. And I'm going to try to find a way to say this without swearing. Stuff happens. We can't always prevent bad stuff from happening. But those things also pass with time. And I think the last one for me, and we've talked about it before around parenting, is to be okay with paradox. So we can feel two different feelings at once. That's okay. We can even believe two different things at once. That's okay too. We do not have to judge ourselves because we want to get things back to normal tomorrow and we're still afraid. That's the reality right now. Another suggestion, especially around COVID times, if you can't beat them, join them. There might be some screen things you can do together. There's online games you can do together as a family. Have your kids show you their favorite TikTok video.
So turn it around and find it as an opportunity to connect.
Exactly.
Okay.
And then this is a hard one for me, and I think it's a hard one for a lot of parents, is we need to give our kids us. So one of the benefits of COVID right now in my family is my kids are more tolerant of me. And they actually don't mind time with me.
We're heading into spring break, which we know does not mean a break from COVID. Talk to us about tips or any thoughts you might have, Julie, in terms of coping with kids and COVID for the next 2 weeks.
So many of us are feeling more sensitive, more raw, more saturated. And so, if your kids are tired, let them be tired. Let them rest. If it means that there's going to be some days in spring break where they're going to just have screen time overkill, maybe set that up in advance and just let that be. If your teens are old enough, I would suggest time apart. And I have to say, this one was validated by my middle child. He was like, yeah, I think we all just need to be by ourselves for a while. For middle schoolers, having a to-do list that they check off might be helpful. And it could be a fun one that you do together. That includes some expectations on your part and then some fun things on their part. Kind of gives you that kind of a quasi-routine, little bit of structure. What are some small things that are special to your kids? Again, in our house, so one of the things that I never buy is sugary cereal. So maybe spring break this year, we're not going on a big trip, but here you go. Here's a box of Fruit Loops. One of the things that we've also done, this one takes a little bit more effort, so take it or leave it, is we have family in other provinces. And so we've done Zoom scavenger hunts with cousins.
How does that work?
So it involves a lot of picture taking on phones and then bringing it back to the Zoom and showing the picture of the thing that you've done or the item you've collected. Don't sweat those small things. Choose what hills you want to die on and find small pockets of joy. Yeah. And I think some of those things will be the things that our kids remember when they're adults, right? Like my kids remember the big trips, but my kids also remember when I bought the box of Fruit Loops.
Julie, thanks so much for your time today. It's been a real pleasure speaking with you.
Thank you. It was my pleasure. Thank you so much, Louise.
We have a collection of online resources and a contact number if you would like to talk, which will appear at the end of this webinar. Now I'd like you to meet some young people in our community and hear their thoughts on coping with COVID.
My name is Malika. I'm a first-year student at UBC. I'm studying sciences, and I'm so glad to be here. I was graduating from high school last year, so I was very excited that I'm going to university and it's a big school. I'm going to meet everyone and have like a big classes and everything, but because of COVID, I had to stay at home and I wasn't able to really hang out with my friends. I think moving on from high school to post-secondary education is challenging for people even before COVID, and with COVID it was extra challenging because we weren't able to meet our professors face to face, so we were just able to contact them by emails and by some social media. But at first it was very hard and very challenging. I talked to some of my friends and I noticed that it's not only me, it's all of the world that are dealing with this situation. So I had to accept it and I had to work on myself more and just accept the fact that I cannot change it and I just have to deal with it and try to be the best I can be. I'm really looking forward to see all of my friends again and hang out with them more and just do a lot of voluntary works and try to be helpful in community. And also I really want to help other people that their mental health have been affected during COVID to just overcome that and get back to normal life. And I think that's all we all need.
So my name is Joseph. I am a university student right now. I'm studying chemistry and computer science. At first we were not very convinced that there was a risk involved, like with the pandemic. Like we thought it might just be something like the swine flu, H1N1, that happened previously. But like later we realized how severe it actually was. Sometimes you just need to go out and get fresh air and like occupy yourself. Otherwise, like all these emotions can build up inside in frustration. And oftentimes, when you're kind of just isolated together, it can cause some issues like domestic disputes. In my case, I've just learned like different ways to like communicate with the family, and that exercise is extremely important, like to get out of the house, go for a walk and stuff like that. Like a lot of people are kind of, it's not their fault, but they have fear of coming into like close contact with others, and this creates a lot of like friction between people. And I think it would just be a lot of relief for many people once this is over and you don't have to worry about like becoming sick and stuff like that.
Thank you to Julie Zimmerman and our youth participants for sharing your experiences. And thank you so much for joining us today. This is the last in our series, Your Mental Health, and I hope you found our sessions useful. If you have any feedback about this session or the series, we'd love to hear from you. LGH Foundation has recently launched a fundraising campaign that will enhance emergency care for people dealing with acute mental health issues. You can learn more about it and donate at lghfoundation.com. On behalf of all of us at Lionsgate Hospital Foundation, I wish you good mental health. Please take care and stay safe.